I'm most passionate about building a company that is explicitly built for low and middle wage families. If you can actually build a company that is built for their unique needs and helps advance their financial health, you'll not only build a company that can scale and serve these millions of people, but you're also just making it easier for them.
So the Futures Fund is VOA's impact investing subsidiary that is putting capital out not only into our own organization, but also into external partners to help to foster innovation and early stage ventures that are addressing health inequities in communities across the country. And last year, with the support of the Humana Foundation, we launched the Community Health Incubator.
Those people that are closest to both the problem and the solution often just don't have the space to innovate. And so VOA does a great job at the national level of bringing opportunity and capacity building to the local affiliates so that they can innovate and they can try new things and still be able to do and provide the services that they do on a regular basis.
In Louisiana, we battle very often from being the worst healthcare state in the country. So anything we can do to help people access services to decrease disparate impacts in healthcare, we want to do that. We have people who are dying on the streets from very treatable illnesses. So through the Humana grant, we have really been able to fill in gaps that we need.
So I founded Let's Get Set about 2 years ago, really to build a financial platform for low-wage families in this country. So our first product starts with tax time and guides families end-to-end through tax time to get their full credits that they risk missing. One of our clients was a first-time mom a couple of years ago. We actually helped her file for the current year as well as the 2 prior years. So we helped her unlock about $15,000 in that first year. And that really was life-changing for her, and it enabled her to, move out on her own with her new baby.
There's a lot of value supporting entrepreneurs alongside investing in our own people at VOA. There's so much that they can learn and cross-pollinate in terms of ideas. 15,000 employees we have out there trying to help people across the country. They understand community health. They understand what health equity is. And you put that group of practitioners alongside entrepreneurs who are trying to develop more market-driven healthcare solutions, and magic, quite honestly, can happen.
As a social worker for over 30 years, working in the community, managing programs, creating programs, the incubator helped us look at it from a business perspective. We learned that if there's no margin, there's no mission. So we want to make sure we can keep doing the mission of Volunteers of America, Southeast Louisiana. And in order to be able to do that, we needed to learn new ways of doing business, and the incubator provided that way.
So the most unique benefit provided by the Community Health Incubator was this opportunity to partner with their affiliates. VOA is working in communities, right, on the ground in communities with some of the most disadvantaged people in this country. Getting the opportunity to pilot some of this work with some of their affiliate sites has been really helpful for us in also getting a direct line, right, to the folks that we're serving. We had a couple partnerships this past year with some VOA affiliates, and I think as we think about, rolling out additional products now, we're going to be going back to some of those VOA affiliates and doing user research, right, with their communities. There's no other, incubator out there that's doing anything like that. So I think is a great opportunity, especially for startups that are looking to build for this demographic.
Financial returns are important. Making a difference in people's lives is even a greater priority. We can actually help the market understand what health equity is, understand the value of collaborating with other community-based organizations. It's just so critical that we don't leave venture capital up to only venture capitalists, and that you bring impact-first organizations into that system.